Hello, everybody, and welcome to our show.
Yep, we made a show. Me and my girl, Dr. Valerie. We've been bigging each other up for the longest. Since before Justin Bieber had bass in his voice. Since Skinny Bobby Brown. When Genuine could dance. Before we would doctor somebody, that's how we made it, despite huge odds against us. Now we're going to help you do the same thing.
Dr. Anise, before we start, I would like for you to please introduce yourself.
I'm Dr. Anise. I'm coming to you from Florida. I'm excited to talk about the power of preventative care.
Wonderful. All right. So tell me, I know that Dr. Anise is one of my good friends, and we had a fantastic conversation earlier where we talked about, and I was blown away because there's so many things that I didn't realize happened in this country, which is that so many people don't really prioritize preventative care. I thought that it only happened in dentistry, but apparently it's also something that happens as far as medicine in general. So please tell us a little bit about that, doctor. What have you found, happening that people when it comes to their health?
100%, Dr. Valerie, you hit the nail on the head because I know from knowing dentists like yourself that people are reluctant to participate in preventative care, but they're very anxious when they have an emergency
And then the smoke got me. I got bronchitis.
or a pain that drives them there. They're very anxious to finally get some care at that point. And I know as a provider, you say, well, I wish they would have just come before it got so bad.
Ain't nobody got time for that.
I've talked to other providers, they feel the same way, particularly in dentistry. But I was talking to you today about a person that called me. So, being the medical doctor in the family, a lot of people will call me and ask.
So dumb. Just because I gave you my number doesn't mean you can call me. Are you alright? I just gave you my number so you leave me alone. Don't call me. It's the audacity to just start calling me when you feel like it. Are you alright?
Me about medical problems or experience they had in healthcare. And was talking to you about a person that called me about having an experience in a primary care setting that made them say, I think I'm not going back to the doctor anymore. And here's where our conversation branched out into a whole discussion that I feel like is important, which is prioritizing preventative care. So we've all had, say car trouble, transportation trouble, but none of us say, okay, well, I'm never traveling again, or I'm never driving a car again because it's a priority. And I just want people to think of it that way. And we all know things are important sometimes, but that doesn't mean we prioritize them. We know we need to get vegetables, but maybe we don't really want to eat the broccoli today. And I guess we're here today to kind of encourage people to eat the broccoli like it's that important, but it's even more important than just the broccoli. So, some examples, like you were saying, in this country that maybe you hadn't noticed because I hadn't, some examples in this country that has brought attention to the problem of not prioritizing preventive care has been particularly celebrities, and not because they're any more important or deserving than the average everyday person, but because they have these set of circumstances where they're not deferring preventative care because of a lack of resources. Like if you talk about a celebrity who's well funded, you know that they have the resources to get to preventative care, but there's evidence that even they struggle to prioritize it. So a recent example is a cyclist named Chris Hoy.
Chris Hoy is sharing heartbreaking details about his cancer diagnosis.
And he is an award-winning cyclist. And he has definitely the funds and he's well known. And so he probably could get in, with a physician, whereas maybe an average everyday person would have a long wait. So we know he has the access, but he recently made public that he has a terminal diagnosis of stage 4 prostate cancer. And, from my experience, even though I'm not an oncologist, I've dealt with a lot of cancer patients and in particular prostate cancer patients. And most of the time, that stage 4 status could be prevented if prostate cancer is caught early at stage 1. Not in every case, but most of the time. So it's just kind of striking that as a celebrity, he had the access, he had the resources, he was a man of status where he could probably see some of the finest physicians, yet he presented with shoulder pain to his primary care physician. So he was saying he thought it might be arthritis, might be a torn muscle, and it was found that he had prostate cancer that had metastasized, meaning it had spread throughout his body to his
Right.
bones. So it was in his pelvis. It was in so many places that there's evidence that he presented pretty late, and he probably had symptoms before this of some sort. Usually symptoms of prostate cancer is like increased urination, pain, things that you would notice. Like the bone pain gets pretty bad, which probably is what drove him for the shoulder pain, but it was in his pelvis, it was in his spine. So
Mhm.
we know this man was probably dealing with significant aches and pains, which would be expected from a sports athlete. But I would imagine that it reached that threshold where if he was thinking about preventative care in the way that I want people to start thinking of it today, he would have said, I have to go see somebody, even if I have to stop my training, even if I have to stop my interviews, even if I have to stop whatever he was doing that was more important in his mind than the preventative care. And so stories like that, Chris Hoy, and then Chadwick Boseman, who's famous for Black Panther, his
Right.
Black Panther role before
Right.
he passed at a very young age. Stories
Right.
stories like that really put a focus on a need to make people more aware of how important preventative care can be and how much it can give you the care you need and a longer life. But even more so than that, if you're not doing it for yourself, for the people around you who would love to have more time with you than maybe they're
Yeah.
given when you're given such a late stage diagnosis. So that was a conversation we were having, and I just would like to know, like, from your end, what are your thoughts?
Well, coming from a background of a Congolese, being of Congolese descent, I thought, that people a lot, like in Africa in general, I'll say, don't really go to see a physician on a regular basis because they just can't afford it, right? So to me, it was really shocking that it happens here because a lot of people have insurance, and many places do take insurance. Like I have insurance, I'm able to go and see the doctor. So then it was very shocking to me, and that's why I thought it would be a good conversation to have, with our audience, just to entice them, or just, ponder that the fact that it's very important. Because I love what you said. There's a difference between having a stage one diagnosis versus a stage three, a stage four. A stage one, more time than none, as you said, something can be done about it. And as you mentioned, it can afford you, allow you to live longer with the people who love you and
Yeah.
who want to see you leave. So then my question becomes, what are some of the facts that cause people, from what you have observed, to not seek out preventative care? I
Yeah.
know of what we hear about dentistry. You have situations like anxiety, stress, lack of funds. But the reason why my attention was caught is because you're saying that it's not always because people
Yeah.
can't afford, they don't seek out preventative care. So from what you have observed, what are some of the reasons why people are deterred or refraining from seeking out or prioritizing preventative care?
Yeah, it's a great direction to go, Dr. Valerie. It's something I really want to talk about because, like you, I really got in my bubble of reasons being socioeconomic related because the very first clinic that I ever practiced in as, like a paid physician was in an area that was right between um, if you look like at the east side of the clinic, you had a lot of people that were from a more disadvantaged background. But on
Mm,
the west side, just a couple of miles down, you had like very affluent people, and we mostly got the people in a lower socioeconomic status. But every once in a while, we would get somebody from the other side for whatever reason they chose that clinic. And so
mhm,
initially, the bulk of patients I was seeing, if they had delayed preventative care, it was for those reasons that we're all familiar with. Like I can't afford it. I don't have insurance. I don't have time. I can't get off from my job. I work an hourly, regular working person's job. So some of the things that prevent are the things that you would expect, like you said, like money and access. So I'll tell two stories to kind of give an example and kind of what I think people should change their mind and how their how their paradigm shift could maybe help them to actually get the preventative care they need and be here a lot longer, or just not have to struggle with a disease. Because if you're pre-diabetic, that's a lot different from being diabetic, and diabetes is a difficult disease to war with.
Mhm.
So if you look at the disadvantaged patient, a story I have of a disadvantaged patient, and it's just very simple. I did not see him because he did have Medicare, but even for Medicare, some are required to pay monthly. Even though it was a low cost, he said I just couldn't afford even just the extra $50 a month that it would have took for me to have Medicare. And then, but once he presented in a crisis, meaning like he had been in the hospital for a hypertensive crisis where he had symptoms while he was riding his bike, and
Mhm.
he fell off his bike and an ambulance came. He got acute care in the hospital, and then they referred him to our clinic, and he came for that initial appointment. But he said, "This will probably be my last appointment. I'm having to pay out of pocket or work out a payment arrangement." And I said, "But you have Medicare." And he says, "Yes, but I declined it because I couldn't afford the $50 a month." And I said, well, sir, let me, talk to the social worker. And the social worker came back and said, "Yeah, but you declined it. But there was a program for people in your particular situation where they could have subsidized and paid the $50 a month. And they went ahead and enrolled you, but he did not know." So if it was a
Right.
priority, he might have searched high and low for his options, but instead he just said, "Well, I don't have any chronic diseases, so I'm just going to do without healthcare this year and hope nothing happens." Again, he was riding the bike, so there was a lot of very physical needs that he had that seemed to take precedence. However, this hypertension was so bad that it caused him to miss work. So in the end, he probably was in a worse state than he would have been if he had got
Right.
a preventative care. And all it would have really taken was some investigation, not even that $50 a month, to find out that he actually was covered by the Medicare. So it's just taking that extra step of saying, "Okay, are you sure? Is there anything I can do? Is there any insurance?" Being that persistent to say, that's how important preventative care is. And then on the other end of the socioeconomic spectrum was a lady that I treated who had chronic problems, and her daughter visited her from out of town. And when she
Mhm.
realized her mom was frequently dizzy, was walking with a walker, and was also not able to like go out and do leisurely things, when a year ago when she had seen her, all these things were not true. She was walking with no assistive devices and she was not getting dizzy. She said, "We're going to a doctor." It does, like the lady was well to do, so she could afford to buy her own equipment, and she had rails all around her house put in. She had all these things to try to prove, but it did not, make her want to seek medical care. Upon questioning, I found out that she was of a particular religion that did not look at you in a positive light for seeking medical care, but they didn't not allow it, but they had some limitations. And I was able to explain to her that I want to respect your religious practices and I will work with you. I may have an opinion about what you should do, but ultimately, you're in charge of your own healthcare and I'm going to work with you. So that doesn't mean you have to disappear. So if I recommend a medication and you don't want to take it, and in her particular religion, they did not agree with medication that they felt like was mind altering. And what that means to a certain group of people maybe is subject to those group of people. And so I told her, "I'm going to take time and talk to you, and we're going to talk about each medication that I recommend. But ultimately, you have the decision to say no or yes. But I don't want you just not to get any care at all. I can send you for blood tests. We can monitor it. Even if you're not taking medicine, we can decide what other alternatives there are. We can work together." So she just
Right.
was unaware of her options. So it wasn't about money. It wasn't about access. It was just about being afraid and not putting it as a priority to investigate it. But when somebody who cared about her came in contact with her like a daughter, was like, "No, I'm going to make this a priority. We're going to see what the options are." So I hope that in this conversation, what we've done is put it out there that, maybe you're a daughter, maybe you're a son, and you want to check in on your parent and say, "Hey, have you done, your annual exam? I really want you to do that because I really want you to be around. And there's a lot of reasons I want you to be around as long as you can be here and have a quality of life." Or maybe you're that person and you didn't even think about, "I have a daughter, I have a cousin, I have somebody I'm close to, I have a sister, and we're the, only family members left." There's somebody that wants you to be here for as long as you can. And maybe you didn't think about it and prioritize preventative care. So let us, today be your family member telling you, please, prioritize preventative care. Is that important? And it can make a significant difference, not just in how long you're here, but also in your quality of life.
Like,
for however long you have left.
right. Because, yeah, that's true. Just, providing you with a better quality of life. Because, as you say, for example, you're finding out that you are pre diabetic, you can do something about it. Versus, you never go for checkups, and all of a sudden, it is the levels are year high. And now,
Yeah,
you rely on medications. And yes, you have insurance, but sometimes, the insurance wants to, you know, do what
play
insurance do,
insurance games.
denying care. So all of a sudden, you have to take insulin, and there you are. They don't want to pay for it. So now it's so costly. So it starts affecting your bottom line versus, if you had gone earlier and it was at a pre-diabetic stage, for example, and it
Yeah,
would have been a situation where it's like, okay, try to exercise, monitor what you're eating, and so you kept things in check, then you wouldn't be, in financial trouble.
yeah,
Yeah,
100%, Dr. Valerie.
yeah. So I
It's
know
the same in medicine as it is in dentistry. Prevention is a ounce of prevention is worth a pound of cure.
it is, because I remember doing a video one time, and I talked about not going to visit a dentist or doing your routine checkup is eventually going to cost you. It's going to
Yeah,
rob you, because by the time you don't go, and now you're waking up at night, you can't sleep, you have to lose a tooth has to be replaced, or even maybe like it can be treated, but like doing a root canal, all of that,
yeah,
it ends up costing you more, whereby if it was a simple filling, it would have
yeah,
been cost. Insurance is paid at 80%, for example, in our cases, from what we see, whereby when it's other types of procedures, now you're looking at 50%. If they will, they would cover. And yeah, it's better to be safe than sorry in layman's
yeah.
term.
I mean, on that note, I would like to clarify something I said because I mentioned Chadwick Boseman, and I want to make sure I'm making it clear that I'm not saying that he didn't get the preventative care he need or he did something wrong.
Mhm.
Certainly, I wouldn't be here to throw stones, at somebody who lived a great life like him. I don't know his particular case, but I'm saying he's an example of someone who was a great loss, not just to the people close to him, but he was also lived a life of inspiration to a particular group of people and just really to all of America and beyond. So
Right.
he was just an example of a great loss, and he, as far as I know about his case, was presented as stage 3 colon cancer. And so I was saying on the note that you were talking about with having to get more work done because you didn't come earlier, he may not have even had the chance to know that, even if he was getting preventative care, because he was on the younger side, and it's unusual for cancer, colon cancer in particular, to get that bad when somebody is that young. So it may have been nothing on his part that he could have done, but it is an example of, like, once he did present in stage 3, to my knowledge, he had to actually have surgery. Where if somebody who's knows that they need screening for colon cancer and get it detected at stage 1, it's as simple as removing the polyp during a colonoscopy, which is invasive for a procedure, but it's not a big surgery where you're having parts of your body having to be removed. So right from the start, he was having to have a big surgery where he was having, parts of his digestive system removed, and that was going to affect him for the rest of his life. So he's an example of just a great loss and somebody who presented in a later stage and had to have a lot done just to even preserve the little bit of life he had left. And maybe there was nothing he could have done, but if you're in the age of like over 60 or whatever it is for your particular situation where you need screening, that screening may save you a lot of trouble. Like you say, even if you're not even thinking about longevity, it just may save you from just having more work done than you would have, if you had have just got it while it was early.
Right, you're right. And on that, I want to give the example of, high blood pressure, for example, which
Mhm.
is known as the silent killer, right?
Yeah,
The see that many times here, even in the office, where we have patients who come, with pain, or maybe we need to extract a tooth or treat a tooth, or even do a cleaning, a deep cleaning, for example. But they come and they present with high blood pressure, and it's to the
yeah,
point that we can now safely render treatment. So now, yes, we're going to give them pain medication, but we can't really do the treatment right away. What about, if and at that point, is where when we send them to the doctor, because they didn't realize they've had it. For instance,
yeah,
I have an uncle who ended up having a stroke, right? He struck
mm,
out, and he fell, and to this day, it's been many decades, he's on a wheelchair, right?
Yeah. Yeah.
So that's because we walk around with, high
Yeah.
blood pressure. Don't ever feel it. It's only in some cases that you would feel, some symptoms with that. Maybe you feel kind of dizzy, or, lightheadedness or something off. But oftentimes, or more time than none, we don't feel anything with high blood pressure. So I remember there's this one patient that I diagnosed simply because, they came in, it was the first time they had treatment. And thank God from them then on, they ended up
Yeah.
following care, being
Being
on
treated.
exactly, and everything is in check. However, there was another patient, that we talked to. It was a pain that she had on a tooth. We couldn't do the treatment. I had highly recommended that the patient would go and see the doctor, and they're like, no, I don't believe in medication, and I'm taking garlic and this, that, and the other. And I really was like, well, I'm sorry, we can't do the treatment today. I highly recommend that you do go see a doctor. So what happened was, a couple of days later, the patient called me, letting me know that that particular day they ended up in the hospital because they felt bad, and actually they ended up having to stay overnight, and was thanking me so much, for the
Yeah.
recommendation. Can you imagine if the treatment was rendered? Only God knows what could have happened. But these are some of the reasons why we are telling the patients, if you go on a regular basis, if you go for your routine care, for preventative care, many things can be diagnosed, and then you can be on your way to having a better quality of life.
Yeah, and I mean that makes me think of what we started with this conversation we've had, where I told you people call me in the family, or people that know that I'm a doctor in this family call me about their medical problems or medical experience. And when you were talking about the patient you had with hypertension and treating it with garlic, it made me think of one person who called and said, I had the worst experience in the emergency room. And I say, well, why were you sent there? Well, she had been scheduled for like a aesthetic procedure, Botox, and they took her blood pressure, and it was 190s over like 120s. And so she ended up being taken there in an ambulance. And some of the components that matches the story you just told is, the acuteness of her situation being found during another procedure, all things that point to a lack of preventative care. But also, when she said, I didn't like the treatment I got, they didn't give me options about what to do about the high blood pressure. They didn't give me medication side effects. And I said, when you present in such an acute way, you're not going to get options, because the priority now becomes your survival. And then after that becomes just handing you over to what? Primary care and preventative care, right where you should have started. So they're going to stabilize you in the hospital, and then they're going to give you over to primary care. And it's not going to maybe be the most ideal treatment for you as an individual. It's going to be what works, because now you have to get the blood pressure down. And she literally said, I would have liked to have tried some things I've heard that lowers blood pressure, like garlic. And
At
well,
that,
if
not at 190 over 120. I'm sorry.
right,
Right,
not at 190 over
from God.
120. Now your options become significantly narrowed,
Right.
because we're just after survival at this point. And also, in acute care and in emergency care, a lot of people complain about just a bad vibe, like they say, I felt rushed, I didn't feel listened to. And it's because they're dealing with dire circumstances a lot of times. And if your circumstances are not dire, they just got through dealing with something dire. So no, you're not going to get the careful, measured, like a very calm care that you would have got with a relationship with a primary care doctor. So when people talk about one other barrier to preventative care, which is a bad experience, the more time that you give yourself to find the right physician, have the right relationship, the more room you have to do that, because you're not in an acute situation. So if you didn't like your primary care experience, just like if you didn't like your dental experience, if you're not at a bad place with your dental health, you have some room and latitude to be able to shop around for the right person, for the right payment plan, for all of that. You can idealize and craft your care to you. The longer you wait, the less options you have. And you might not like your experience, because the emergency room is not for primary care, it's not for preventative care. And but you end up making it that. So maybe her doctor 2 years ago could have worked with garlic, but what it can also do is monitor whether it's working. So if you say, no, I really don't want to have to take lisinopril, and they say, okay, Go ahead and try garlic. Go ahead and try exercise. You're not at 190 over 120. You're just a little bit elevated. So come back in a month and we'll see if that's working. Oh, it's not working. Let's try this. Let's try that. You have a lot more options. You can experiment. But as you know, the more acute and the more crisis centered it is, the less options you're going to have.
Exactly. Exactly. That is true. So really what we're saying, we're going to this is a conversation that can keeps going on and on and on. But what
Yeah,
we doctor is we are really pondering, like letting people know that it's very crucial and very important to actually, go and make preventative care a priority.
a priority.
Right. I see many of my patients who have children, they make it a point to actually take the children to the office because they say, when I was younger, my parents did not really take me to the doctor, or whenever I went, I just had teeth taken out, and I don't want that to happen to my children. And that I love it because it stems from, a level of care. They want to actually do the best for their children. And I want to spin it around to say, if when you take care of yourself, you are also taking care of your children, because now, as we were saying earlier, you are allowing them to benefit for your presence for a longer time. So prioritize yourself, or prioritizing yourself is actually also doing the good for these people that you actually do care about, for whom you would give, your best. So give them the best health.
I agree. Definitely.
All right. Well, this was a great conversation. I'm sure we'll have many more, and you will always be welcome for many more conversation. But I wanted to ask you, Doctor, if somebody wanted to have your insight on anything, how can they find you?
It's very simple. It's my name with doctor in front of it at gmail.com. So it's Dr. Anise at gmail.com. And I know that name isn't common, so I'm going to spell it out for you. So Dr. DRANEASE at gmail.com.
Wonderful.